Viagra versus Cialis. You know the names. Sildenafil versus tadalafil. You might know those names too. They're two of the biggest medications out there for erectile dysfunction. But what really separates them? I mean, is one just stronger? Does one last longer? And the big question is, how do you know which one might be the right fit for you? Okay, let's just get right into it and break this all down nice and simple. Yeah, so that's the big question we're tackling today. We're going to look past the brand names and really get to the heart of what makes these medications different, how they work, how long they stick around, and how they might fit into completely different lifestyles. But hang on, before we can compare them head to head, we've got to understand the basics. You know, knowing a little bit of the biology is really the key to seeing why they're different in the first place. So let's start with how an erection actually works. Okay, so it all starts with arousal. That initial spark triggers the release of a chemical called nitric oxide. That, in turn, creates something called cGMP. And you know what? That is the real star of the show here. cGMP is what tells the smooth muscles in the penis to just relax. That relaxation allows blood to rush in, and once it's in, it gets trapped, which is what creates firmness. It's actually a pretty elegant little process when you think about it. So where do these pills fit into all this? Well, both sildenafil and tadalafil are what we call PDE5 inhibitors. So what does that mean? Basically, there's an enzyme called PDE5, and its job is to be the cleanup crew. It comes in and breaks down all that cGMP. These medications work by blocking that cleanup crew. And if you block the enzyme that gets rid of cGMP, you keep more of it around for longer. More cGMP means more muscle relaxation, better blood flow, and a stronger, more sustained erection. And this is a hugely important point. We have to clear this up because it's a common myth. These pills are not a magic on switch. They do not create desire or arousal out of thin air. They simply help your body's natural response work better. You still absolutely need to be sexually stimulated for them to do anything at all. They work with your body, not in place of it. You know, for all the talk about their differences, they actually share a lot of common ground. For one, they're both very effective for a huge majority of men. And they have similar common side effects, things like headaches, facial flushing, maybe a stuffy nose. But the one I really want to highlight, the big flashing red light, is the safety warning. You should never, ever take these medications if you're also taking nitrate medications, which are often used for chest pain. That combination can cause a really dangerous drop in blood pressure. Okay, now that we've got the basics down, it's time for the main event. Let's put these two right up against each other and see where they truly stand apart. This chart really lays it all out, doesn't it? These are the three biggest, most practical differences. First up, duration. This one's a biggie. Sildenafil works for about 4 hours. Tadalafil, up to 36 hours. Just a massive difference. Second is food. A big, fatty meal can make sildenafil less effective. Tadalafil, on the other hand, doesn't really care what you've eaten. And finally, dosing. Sildenafil is strictly on demand. You take it when you need it. But tadalafil gives you two choices, on demand or a low-dose daily pill. Let's just stop and think about that number for a second. 36 hours. This is tadalafil's claim to fame. No question about it. It's exactly why it earned the nickname the weekend pill. I mean, you can take it on a Friday night, and it's potentially effective all the way through Sunday morning. It just removes so much of the pressure of timing. And this visual really drives that point home. I mean, just look at the difference. That small window for sildenafil versus that massive window of opportunity for tadalafil. For a lot of people, this single factor is the most important one because it can completely change how spontaneous you can be. Now, while they share those common side effects we mentioned, they each have their own unique, though less common ones. With sildenafil, some people report temporary changes to their vision, like seeing things with a bit of a blue-green tint. For tadalafil, the most distinct side effect that some people get is muscle aches. And here is another major point in tadalafil's favor, that daily option. Taking a low dose every single day means you are basically ready to go whenever the moment is right. It totally removes the need to plan ahead. And it comes with this really significant bonus benefit. It's also approved to treat urinary symptoms from an enlarged prostate, or BPH. So for some men, it's a real 2-for-1 deal. Okay, so we've laid out all this information. How in the world do you actually decide which one is right for you? Well, let's break it down into a practical choice based on your own life and what you're looking for. Sildenafil might be the right call for you if you really only want to take a pill right when you need it. Maybe you even prefer that shorter, more predictable 4-hour window. It's a great choice for someone who is totally fine with a little bit of planning and doesn't mind thinking about timing it around a big meal. On the other hand, tadalafil is probably going to be a better fit if that huge 36-hour window sounds amazing to you, if you really value spontaneity and the freedom of that daily pill, or if you just don't want to have to think about food. It's a great option. And of course, if you're also dealing with BPH symptoms, it becomes a very, very compelling choice. All right, before we wrap this up, we need to take a step back and talk about the bigger picture, because honestly, this is about more than just a lifestyle choice. And here's why this is so incredibly important. Think about it. The blood vessels in the penis are much smaller than the ones around your heart. This means that erectile dysfunction can sometimes be one of the very first clues that you might have an underlying cardiovascular issue. It can be like your body's own early warning system. So at the end of the day, there's no clear winner here. One isn't just universally better than the other. The right choice is a completely personal decision. It depends on your health, your lifestyle, and your goals. And that makes the most important takeaway from all of this incredibly simple. Talk to your doctor. Have a real, open conversation. They're the only one who can help you make the safest and most effective choice for you.